So one other quick reminder, these webinars, as you now know, are on Thursdays at this time, noon Central, 1 p.m. Eastern, 10 a.m. Pacific. They're every 2 weeks. Our next one is on August 6th, and we got some really cool stuff planned for that one that I'll tell you a little bit more about in just a moment. So I wanted to start with some information, and again, Sean's here, and he'll be sharing some really great information in just a little bit, but Sean, please feel free to just jump in anytime with comments. This is a look at just sort of the latest COVID stats on both cases and fatalities. And, I think sometimes what you'll see sort of on the news or elsewhere is there'll be like a chart with with cases, and it might be a cumulative chart, which is helpful to see, but it makes it really sort of hard to discern what's going on, because a cumulative chart just by definition sort of keeps going up and up and up and up and up. And what we really sort of want to focus a little bit more on is what is the vector. So we wanted to show both what's happening with cases, which is very, very concerning, because you can see that line is going up, as well as what's happening with actual fatalities, to put some of that in context as well. I wish we were in a world where you could just look at these charts or these numbers and have a very objective view on precisely what they mean. Sadly, we're not in that world. There are questions about what is a case and what is a death, and has the methodology changed in some way. And you can even see that there's reporting stuff happening in here. So look at these curves. Like, let's look at if you look at the death curve, it's a little bit more apparent there. Take a look at this. You see there's like peaks and valleys pretty reliably every week, right? It's like, 5 up days and then 2 down days, basically. That's just the way things are reported. You can actually see the weekend effect. It's not as though more or fewer deaths are happening on a Saturday than on a Thursday, but it's just literally the reporting mechanisms that are in place. So I think it would be helpful as we look at these sort of stats that are made available to us on the news or for public download or elsewhere. You almost want to think of these on like a weekly basis to smooth things out. If you hear someone say, "Hey, we had the most or the fewest deaths yesterday," that might just be because we're at a peak like a Thursday or a trough like a Saturday, Sunday. A weekly smoothing out may actually be a better view if you really want to do an apples to apples comparison. But we did want to focus on the fact that, this is fairly alarming that we've seen an acceleration of new cases. So not cumulative cases, but daily new cases. And yes, you could say maybe this has to do with the fact that more people are getting tested or other reasons, but that line is the line, and regardless of what is causing it, it is the line that a lot of people are seeing, and it is impacting how we feel about COVID and what we feel is safe. So with that, we wanted to share a couple of updated stats on some of those key metrics that we've been tracking around whether you're personally concerned about COVID. So before we get there, I would actually love to hear from all of you, and this is maybe the quickest, fastest poll ever. So compared to 1 month ago, literally compared to 30 days ago, how personally concerned are you about COVID today versus a month ago? Yeah, so not business, not work, but just how personally concerned are you? So Sean, I don't think anything you say here is going to bias anyone. How do you feel?
I think just because of like the past week, the COVID task force come back, gotten back together, and you see the president talking about it, and you hear more states are mandating masks, and just the numbers. I think actually, this week I'm more concerned than I was past week. It was getting better for a while, but I think the past 1 or 2 weeks, I think I'm more concerned now.
Yeah, I would probably be there too. So let me let's see how people have voted. So if you have not had a chance to vote yet, I apologize. I'm going to cut you off real quick so we can share the results out. So here's what our community says. And this is, I think that feels pretty right. Like if we had to make a prediction, I think it would have been something like this: a minority saying less concerned, the majority, almost half saying more concerned, and about a third saying, it hasn't really changed all that much. So net, the concern does seem higher, within our community. And the question is, what does that look like for U.S. consumers on the whole? And here's what that actually looks like. So you remember we've had a period of time where the level of personal concern was going down and down and down and down and down and down and down. And we had actually said, in the absence of any major news, we expect that number to just continue to drop. You could argue that we were wrong because the number has spiked up, or you could argue that we were sort of right because there has been new news, which is that we've seen a lot more cases. So maybe we're splitting hairs with that, but the net is we've seen a bounce back, in the last few weeks that takes us essentially back to where we were, sort of like late April, early May. And we'll see how quickly this works with the cycle. And I guess we really have to see what happens with that line going forward as well in terms of cases. I mean, the good news is the shape of the curve for new cases versus the shape of the curve for new deaths, those are different looking curves. I would argue that people staying alive is probably the most important thing, but the case count is, of course, worthwhile to be concerned about. The other major stat that we've been tracking is, are you definitely avoiding eating out? And here's what that looks like. So a similar spike as well. This returns us basically to like early mid-May levels. You'll remember that we got to a high of 68%. This is after we saw some of that initial guidance from the White House that we might have as many as 2 million fatalities if they're, if we didn't have the appropriate social distancing and people watching out and doing the right thing, and we didn't mitigate. But here we did not see a spike that returns us nearly to that level, right? So I think what you're probably seeing is people said, yes, I am more concerned, but I've started to do this sort of eating out behavior, and not everyone that started to do that or started to consider that has said, I'm willing to completely give that up. I think they've just sort of like added that to the number of things that they are open to doing. So we've had a bigger spike, and I'll go back, a bigger spike in being really concerned about COVID, and relatively speaking, a slightly smaller spike in definitely avoiding eating out, because I think some people don't want to necessarily go back and lose that. So here's a question, and I'm going to ask you as well, and here's another just really quick poll. If you had to guess between these two groups, and this again, probably as fast as it gets, between men and women, who is more likely to definitely avoid eating out these days? So I will say this, I am sort of shocked that at the split we're seeing in the votes right now. Sean, I thought we'd see something closer to like 60-40, 50-50 people guessing one way or the other. It's like 86-14 right now. It was like 90-10 just a few seconds ago. Any guesses if it's men or women that?
I mean, based on my friends and my family, I would say probably women are the 84%. Just like I see that more of concern, like through like my circle of.
Yeah. So let's see. I'm gonna hit the end on the polling. We'll share the results out. So, yeah, our community voted that they believe it is women more so than men by a huge margin. The question is, are we a bunch of really smart people in this community, or did we guess completely wrong? Well, we actually did a pretty good job. So here are the numbers. 44% of men say they're definitely avoiding eating out, and 58% of women. That is actually a pretty large gap. I mean, there's some things you see in research where the male-female split has like a pretty big gap between them. But usually the gender split tends to have a smaller impact on things like preferences and whatnot than you see with generation or ethnicity or even region in some cases. That 14-point gap that you see here is actually pretty significant. And to put it in context, here's that definitely avoid eating out number by men versus women, and then by generation. There is as big of a gap between men and women in this respect as there is between Gen Z and boomers, which is remarkable, because the thing that we know about COVID is that it is, really quickly turned into a story of who's in the at-risk population, and the at-risk population are the ones that are being, most conservative in avoiding things that might expose them to risk. But you're actually seeing as much of a split between men and women as you are between Gen Z and boomers, which is actually quite remarkable. I'd have to go back in the data, but I don't think the male-female split was quite as intense earlier. So I think a lot of it has to do with like the more recent news cycle and what we're seeing with more cases, and that somehow that is bleeding a bit more into how women are thinking and behaving about this versus men.
I think it's interesting too, Jack, because I think more men are prone to get sick than women. I think I think that's what I heard in the news, is like, you see a lot more men getting sick. I don't know if that has to do with gender or, just because, men go out more, but it's interesting that, more women are avoiding eating out.
It's a great point. And I feel like us even trying to theorize as to why will do nothing but get us into hot water. So I'm going to avoid that conversation entirely and just note that there is a split. So if there's a brave person out there that has a good scientific explanation, you have chat, but be careful is all I can say. The other thing that we've seen, and this is actually worth noting too, is we've been measuring if people perceive COVID to be more of an economic crisis or a public health crisis. When we first started tracking this, I think the numbers were like 63% public health and 37% economic. Over time, the numbers got a little bit closer to 50-50. With the recent sort of rise in cases, we're back to a 61-39 split. So health is on people's minds again. But I think it is a little bit different this time, where before we were just sort of like, oh, I have no idea what to do. We probably do feel like we have a little more agency in protecting ourselves. And I wanted to, before we jump into some of the consumer findings, to just provide a quick update on what's happening with things like restaurants openings and closings, and what is the food that's available to us all of a sudden. So I think many of you know this already, but we have a system called Firefly. It is literally a data set of every place that serves food in the US and Canada, every restaurant and hospital and school and college, hotel, you name it, with extraordinary accuracy and deeply profiled. And one of the things we've been doing with Firefly over the past several weeks is we've been getting opening and closing data that we've been compiling on about 600,000-700,000 restaurants on a weekly basis to see who's open, who's closed, what their status is. And here's a question for you all, and maybe you could share your thoughts in chat. Which state in the US has had the most net restaurant openings over, let's say, the past 2 months, right? So, and this is by percentage, right? So has had the greatest percentage of net restaurants opening. So that means if you look at the restaurants that have opened or reopened, and you subtract the restaurants that have since closed during that 2 months, that would be your net restaurant opening. So use that chat and make a guess. Which state, on a percentage basis, do you think has had the most net restaurant openings between, let's say, early mid-May and today? Sean, I don't know if you're monitoring chat.
I am.
Are we getting any?
We're getting a lot of New York and Florida. Some
Florida.
Texas, but mostly New York and Florida is what I'm saying. Some Texas as well.
So what the background that you have, the beach in your Zoom, do you know where that is?
No, I do not. Is
that random generic Zoom
just,
beach?
Yeah. It was just a Zoom.
So I asked because the actual answer is explained by this chart here. So we're going to look at the percentage of restaurants that are closed. This includes permanent closures as well as temporary closures. And here's what that number looked like on May 6th, that pink line. And here's what that number looks like as of July 13th. So please keep in mind that this does not include, let's say, the last, what is today, the 22nd or 23rd?
23rd.
23rd, yeah. So this lags by about 10 days, and there have been things going on in the last 10 days with some cities or states going to an early phase of their reopening plan. So a lot of that's not captured in here, but it's still pretty recent, July 13th. And you can see that there is a pretty big gap between the two lines. So net in every state, we have fewer restaurants closed today than we did in May. And this chart is actually set up so that the states that have the biggest net percentage of restaurants that have opened since then are further to the left. And that would be Hawaii, DC, Nevada, New York, and Washington. So take a look at Hawaii. So the answer to the question, which I don't know if many people guessed, it's actually Hawaii. May 6th, 23% of restaurants in Hawaii were closed. As of July 13th, that number is down to about 11.5%. And you can see what it looks like going forward. Now, I will say, I am probably a little bit worried about like restaurants in Hawaii in the long run. I mean, think about how much of that state's business comes from tourism.
Tourists, yeah.
I have no idea who the heck is going to be going to Hawaii anytime soon. So if anyone on chat is, from the great state of Hawaii, if you have a perspective on that, I'd be really curious if you wanted to share your thoughts and ideas with the rest of the group. But you can see, I think the general good news is that in every state we've seen a net reduction in restaurant closures, and in some cases by a pretty wide margin. In the past 68 days, 28,000 net restaurants have either opened or reopened. That is quite a number of restaurants that have come back on net online. And to understand the way this number works and what it actually means, you have to sort of look at both sides. So 28,000 net restaurant openings in the past 68 days, that's about 4% of the total restaurant universe in the US having come back online in net. And the way that you construct that number is you see that there's 36,000 restaurants have actually reopened during that time. About 5% of all restaurants were closed and then either reopened, or these are maybe even just brand new restaurants, amazingly, that weren't even there and opened up for the very first time in the midst of COVID. I'll give you like a personal anecdote, and I have no idea if this holds true. We have no specific data on this, but I've been to a couple of places that have opened up, like literally open, not reopened, but open for the very first time during the pandemic. And now when I sort of just drive around and look at restaurants, those look to me to be some of the most crowded restaurants that I see. I wonder if consumers are thinking like, okay, if this place can open in the pandemic, they probably really figured things out. They're newer, they maybe have better safety standards or something. But that was really interesting. But again, it is a pretty small sample size because there aren't a lot of restaurants that have done that. So about 36,000 have opened, and about 8,300 have closed that were not already closed. So you go back 68 days. In the 68 days that followed, and an additional 8,000 restaurants have essentially closed up that weren't previously closed. And if you think about what those are essentially mostly permanent closures, places that have that tried for as long as they could and just could not make it anymore. So let's look at how these numbers work. So as of May 6th, you had 8.2% of all restaurants in the US were temporarily closed, 3% were permanently closed. Your total closures were 11.5%. As of July 13th, the temporarily closed number drops way down to 3%. You had a lot of net restaurants opening, but the permanent closures increased. They went from 3.3% to 4.5%. But on net, the total number of restaurant closures is only about 7.6% now. So about 92, almost 93% of restaurants are open. Sadly, though, some of that is because we've seen some restaurants just close permanently. That 1.2% increase in permanent closures, that does represent, a number of restaurants that just couldn't make it anymore, that aren't coming back, at least not in that form, which is sort of a sad thing to see. But we are seeing on net more restaurants come back online. Let's take a look at this in terms of the change in closures. So we're looking at the net change from May 6th to July 13th. And we're going to look at this by restaurant segment. So this requires a little explanation. We'll use QSR as that example. So in quick service, we have 1.7% of restaurants that were closed have now opened. Those temporary closures, right? So you have a reduction in temporary closures, but you have an increase in permanent closures. On net, you have a reduction in closures. So you have 0.5% fewer closed QSR units today than you did in early May. But again, I think there is a little bit of pain there because some of that came from the fact that some places are just now permanently closed. In fast casual, you have a few more fast casual places that weren't able to make it, so that positive 0.4 for permanent closures. But you had a massive number of places that were temporarily closed that are no longer temporarily closed. They've reopened. Now that said, I think Starbucks is actually a pretty big chunk of that number just by itself. So just keep that asterisk in mind. In mid-scale, you can see a generally similar pattern. You've had a number of mid-scale restaurants, 4% open back up, but you've had 1.2% of them close up for good in the last 68 days. In casual dining, you'd had about 7% of restaurants open back up that were temporarily closed, but over 1%, 1.4% have since not been able to make it, and they're now permanently closed. And then in fine dining, you had a ton of restaurants, and these are not chains, these are mostly independents, that have reopened, right? Fine dining was really, really challenged during the height of the pandemic, where they're like, I have no idea how we're gonna do what we do, because so much of what we do is seating people and service and the entire experience. Many of them have opened back up now, but about 1.6% of them just have not been able to make it. On net though, you only have about 11% of fine dining is now closed. So almost 90% of fine dining restaurants are actually open these days. So this is a changing story. We'll continue to update this over time as the story becomes, continues to be interesting and the numbers continue to change. But that's what it sort of looks like today. And one way of thinking about this is what it looks like on a state-by-state level. So as of as of July 13th, here's the split of permanent closures and temporary closures by state. And you could look at sort of the ranges, right? So temporary closures, the lowest state has about less than 1% of their stores are temporarily closed. But in DC, almost 12% of restaurants are temporarily closed. Permanent closures trade in a much tighter range of between about 3% to about 6.5%, depending on the state. What's noteworthy is not just the state of things today, but what it looks like versus, let's say, a couple of months ago, where you had much, much, much bigger ranges. On May 6th, you had some states that had as high as almost 24% of stores being temporarily closed. That number's been halved since then. On May 6th, you had a range of permanent closures where the state with the fewest closures that were permanent were about 2.4%, and the highest state was about 7%. Now it's shifted a little bit, where the range has tightened a little bit more, largely because many states have actually added permanent closures, and some of the things that were temporary and sort of borderline became permanent. So a lot of restaurants have reopened over the last couple of months, but more have also now permanently closed and are now permanent casualties of COVID. And the question is, what happens as we move forward? Because I think what we saw pretty early on, we talked about this thing called the variable population rate ratio, and how that was a really big determinant as to whether a restaurant is going to make it or not. We saw that a lot of this was not so much a public health story, but really an economic story. for restaurants, that if you don't have just customers around, it becomes really tough to keep going. And the question is, what happens to those restaurants that are still with us today moving forward? And I want to go back to an insight from some of the one table work that we worked on with many of your companies, which is this, that in the midst of COVID, if you ask operators, hey, what are you selling more of and what are you selling less of, or has it not really changed very much? You know, most places have been selling less of everything because the traffic wasn't fully there. Some brands on the chain side have actually recovered nicely and now have higher same-store sales today versus the same month last year, which is incredible. On average, though, that's not really the case just yet for all restaurants. But if you look at where you had, increases or decreases in sales, it tends to be like entrees did sort of okay. 28% of operators say I'm selling fewer entrees versus 18% say I'm selling more. It's in all the other categories though where you've just gotten like whacked, right? Sides, appetizers, desserts, beverages, those have been way down. And if you think about it, those are the categories that tend to be most profitable for an operator, right? The food cost on an entree might be as high as 42, 45%, let's say, versus a food cost of, 10% on some beverages, 20% on some appetizers and desserts. So we've taken the most profitable parts of our menu and basically just obliterated them from a sales perspective and shifted more of the menu mix toward the things that are less profitable. This is going to come to bear, I think, in the weeks and months ahead, that it's no longer just going to be a question of, can I get people into my door, but is the business itself profitable? So the hope is that we have, most of the restaurants that are with us, or the vast majority, continue to operate and hang in there and do a great job. But I think the economic reality of what is profitable should cause, at least a few more of those restaurants to move into that permanently closed category if they're just not able to survive. And probably operators as a whole rethinking what the constitution of their menu is so they can get profitability back into each check. So with that said, you may remember a couple of webinars back, we talked about the 7 big lessons from the pandemic. The first one was goodbye fear, hello caution, which is that we've moved from this mindset of being just totally freaked out about stuff and paralyzed and we don't know what to do, to now being able to say, okay, I've done this for a while, I just need to be cautious and I can take some agency in my own actions, and I have some control over my own destiny, as opposed to just being totally paralyzed in fear and being irrational. So how's that playing out with consumers today? So compared to a month ago, would you say you're personally being more careful, less careful, or no change? A majority of Americans are being more careful today than they were a month ago, right? So it's sort of like that line that we saw goes, it dipped, and now we're going back up in being cautious. And if you look at this, there's a question of, well, where do you feel like it's safe to eat? So we're talking about just restaurants for a moment, chain restaurants versus independent restaurants. In March, sort of in the early days of the pandemic, the sentiment was, oh yeah, independent restaurants, that's way safer than chains because, I know the people at the independent restaurant, I know that family, or I know the people there, and I know, they're smaller and they're always looking out for their customers. And then as we got into June, the numbers started to shift a little bit, where you still had a little bit of a vote on the side of independents, but not as much so, right? It was getting a little bit closer to 50-50, and now today you're at a straight 50-50. So that sentiment has moved in a pretty material way over a pretty short period of time. And a little bit later on, Sean's going to show us some data on which particular chains consumers really feel safe and good about eating at these days. But that is a pretty big shift. What do you feel comfortable doing today? And again, this is our most recent data from just a couple of days ago. So people feel safe still going to the grocery store. They feel safe going to the doctor or dentist. I don't know if I feel safe going to the dentist, but people feel like that's okay. You can see some of the other areas. Movie theaters is a challenge. Gyms are a challenge. School is a bit of a challenge. That's a big topic. right now. Beaches, I actually thought that was sort of interesting. I guess it depends. Like if you're thinking of a beach like the one behind you, Sean, that's pretty safe. If you're thinking about the beach you see sometimes in like pictures, on the news where they're just overcrowded, that's a little bit scary. But the question is, how does that compare to some of the ways that you might go about getting food? And here are the numbers. So what do you feel safe and comfortable doing? Well, drive through, yeah, I'm good. Curbside, great. Delivered, great. Then you have a little bit of a drop off. You have a 16% drop between curbside and then going into a restaurant to pick up your order. Then you have a little bit more of a drop to dining outdoor or on a patio at a restaurant. And when you get all the way down to the bottom, going inside and sitting at a bar, basically, in the main seating area, that's where you get, really, pretty small minorities of people feeling really safe about that. We talked before about how the car has become sort of this protective bubble for people. It's sort of like an extension of themselves in some way. And I think that continues to hold true today. I will go back to a piece of data from June and a comparison toward April, which is around this notion of trust. Which sources do you trust to get good advice around COVID? And you can see that there's just been like a decline. These numbers were not high to begin with, but like basically decline in virtually every potential source other than your own personal primary care doc. So that was certainly a movement in the wrong direction and not a very encouraging thing when we don't know who we could trust anymore. And you see it pretty clearly because we just got this new number a couple days ago. 79% of Americans agree that it's hard to know what to believe or who to trust about the current state of the pandemic. That is a very unfortunate number, that 4 out of 5 people say, I just don't even know what to believe at this point. At a time where we need, facts and some level of certainty, more than ever, 4 out of 5 people say, I don't even think I can trust any of the sources. I don't even know who to turn to. And as a result, we're seeing in the data that it seems like people want rules right now, more so than we've seen in the past, more so than we've seen probably in other events. I'm not a sociologist, so I don't know how this compares with other historic events. But it does seem right now that people actually want some rules. So take a look at this. 83% of consumers say that restaurants should require guests to follow specific safety guidelines. So this is not being specific to any particular guideline, but 83% say restaurants should have a requirement that guests follow some standard of practice, whatever that standard of practice is, compared to just 31% that say restaurants should not be required to follow safety guidelines. So here we're talking about the restaurant and not the guest in that second stat. But only 1 in 3 say that, restaurants should be absolved from following specific guidelines and should be able to just do whatever they want themselves, and that the guests should just be responsible for acting responsibly, right? And just sort of like leave it to the people, leave it to the restaurant to figure it out, as opposed to having some set of rules that are expected to be followed. So it looks like people do want rules these days. And they're also baking this into their consideration about where to go. A lot of times it's just about communicating, right? Making sure people know that if you're a restaurant or a business or a food retailer or something, that you have policies in place and they're easy to find. 80%, I will be more careful to check if places are strictly enforcing safety precautions before deciding where to eat. This is not a small minority. This is the vast majority of consumers feel this way. So you have to not just have a policy, you need to show that it's in force and in place. It needs to be overt in some way. It cannot be this mysterious thing that just sort of floats in the ether. And one of the core policies that we're going to talk about today that has sucked up a lot of the attention and airtime, I think rightfully so in a lot of cases, is just about, are you wearing a mask or not, right? No shirt, no shoes, no mask, no service. And I sort of joke, because I actually think that sort of makes sense. You have a lot of people saying, hey, you can't tell me not to wear a mask. But like that no shirt, no shoes, no service thing, we've seen that thing at restaurants like, I don't know, like 40, 50 years, haven't we? I don't actually remember a time when people were trying to go into restaurants without a shirt or shoes. I feel like that's a very uncommon event. So I don't know like why we had to create that sign in the first place 50 years ago or however long it's been. But I guess it's effective because I don't see a lot of shirtless, shoeless people in restaurants. And it looks like masks are sort of getting added to that list. So the question is, what's going on with masks and with consumers' attitude and their sentiment toward masks? So there's a lot of information out there, and we're going to make this as or non-political as possible, right? So there are a ton of stories that talk about new evidence or new studies showing how how masks help stop the spread of COVID. There's videos where you could see like someone blowing through a mask with like these crazy lighting technologies. So you can see little particles and how the mask like blocks the particles. So there's a ton of that. There's also information that exists out there from actually people that you would say are reputable, like a well-known epidemiologist who will say, hey, I'm not quite sure that masks actually do what we think they're supposed to do, or if they make any real difference. So it's not as though there's only one strain of information that exists. There's a lot of stuff floating out there, which is, I think, what's making it hard for some people to say, I have no idea what to trust, because these don't look like crazy people. And it says that they, are, tenured and have done a lot in the field of science around epidemiology. So they seem like they're credible, but they're telling me something that probably disagrees with everything else that I've heard and doesn't make a lot of sense to me. But it exists out there. And it's become sort of political, right? Wearing a mask is for smug liberals, refusing to is for reckless Republicans. Welcome to Washington's latest partisan standoff, the article in Politico. But I think it's something that we all see and feel basically every time we turn on the TV, there's a conversation around masks. There's like some pretty crazy stuff too. This is the new symbol of tyranny. A mask is a muzzle. I don't know about that. I will say that this person who made the sign did a really good job, because you tell they printed like 8.5 by 11 sheets of paper and just sort of like taped them together. They did a pretty seamless job. It almost looks like they went to a print shop. They did a nice job putting that together, but the sign is a little nuts, if you ask me. But masks have become politicized. But I think maybe it's politicized more so in media, politics itself, and perhaps more at the fringes of our culture than at the core of our culture. Because we can actually see what people really think, right? It's, you turn on the news and it's like, oh my God, it's like you have half the country, wants to wear a mask all the time. The other half are like these vicious anti-maskers, and there's going to be a big, mask riot or something. The numbers don't really suggest that, because 80% of consumers support a national mask mandate. It's not a 50-50 split. If you look at just the people that say they become more careful in the past month, that number rises to 91%. So there is a pretty clear consensus around, hey, you know what? Maybe I don't know the exact science of this, but better safe than sorry. And if this helps us get things going again sooner, why not? And if you look at the things that people believe are the biggest reason for the surge in cases, the recent surge in cases in COVID, here's what consumers think. More so than people crowding into places, even, they think it's the lack of people wearing masks, or people that aren't wearing masks. So that's the sentiment. And look, neither Sean nor I are here to, provide like our personal, opinions on what this might be. We're just sort of reporting what people think. And what people think is there's actually a pretty clear consensus. 80% say, hey, we should have masks on. And if people haven't figured that already, they would even support a national mask mandate to do so. So, okay, we're gonna switch gears a little bit. Many of you use our Snap platform, which is awesome. It has so many wonderful things in there. And what Snap basically is a giant container for all of Datassential's online services, which includes things that support innovation. It supports, brand development, as well as growth solutions. And one of them is something called Flavor, which is literally anything you could eat or drink. You know, do people know what it is? Do they love it? Do they hate it? Have they tried it before? Do they like it all the time? Thousands of different things. And the traditional measures are, do you know it? Have you tried it? Have you had it multiple times? Do you love it? Do you hate it? Do you fall somewhere in between? And you can see how this ranks by consumer type, region of the country. You could look at visitors of specific brands or users of specific retail stores. So what does the Burger King customer think about different flavors? What does the Walmart shopper think of different flavors? And those are what things we measure traditionally in flavor. Given the pandemic, we said it'd be really helpful if we came up with some new sort of pandemic specific metrics that we think is going to matter even more. And here they are, which is for these various types of food items. Do you prefer to consume this at home or away from home? Do you prefer to get it or to make it at home or away from home? And how strong is your craving for that item now, given that we're in the midst of a pandemic? And Sean, I'll let you take us through some of the things that we learned. Just let me know when to advance each slide.
Okay, thanks, Jack. So here we're looking about for items that consumers crave or cannot wait to have. Looking at the top 10 list, we see a lot of identifiable favorites and staples like pizza, we see burgers, steak, we see Asian and Mexican food. At the top of the list, we have cheeseburger, which has an index of 165. That basically means cheeseburger, 65% more consumers cannot wait to have a cheeseburger than any average food or beverage item. Next, click. Let's look at a list of things that consumers want to get outside the home instead of making them at home. We see a lot of Asian food. We see also at the bottom of the list, we see chalupa, calzone, Cuban sandwich. If you look at the first one on the list, they're Japanese food. So that's your maki, sushi, things that include raw fish or need a professional preparation technique. Things that we cannot easily make at home.
Yeah, and so, the way we're reading this is the chart on the left is basically how much are you craving things, regardless of where you might get it from. The chart on the right is if you were going to have that food, would you want to get it at home or outside the home?
Right. So what if we want to look at them together? So there are a lot of dots on this chart. Each dot actually represents a food item or a beverage item. If we and the way to think about this is if you look at anything at the top of the chart, those are things that people prefer to get outside the home. Anything on the toward the bottom are things they prefer to make at home. Another way to look at it is if you look at the right-hand side, these are people that many people crave, more craveable items. And if you look at the left-hand side, these are things that fewer people are craving.
Yeah, and we should know that this was fielded in the midst of the pandemic. So right. This is like, given the current state of the world, what are you craving, right? Maybe you haven't been able to have certain things. Maybe you've been eating too much of certain things. Given all that, what are you craving today?
Right. So in your mind's eye, you can actually divide this into 4 quadrants to kind of make it easier to look at. So if you look at the bottom right-hand quadrant, we have steak there. Steak is highly craveable because it's closer to the right-hand side. But as far as where they want to get it, most people prefer to make it at home. It's closer to the bottom. If you look at another item in that section, we have coffee. So coffee is also craveable, not as much as steak, but still in the craveable section. But more people prefer to make it at home. So now let's move to the left and look at items that fewer people crave and most people prefer to make at home. You have peanut butter and jelly or jam. Some people like it with jam. And what we see here is basically fewer people crave it. More people want to make it at home. If you were to walk in your kitchen right now, you could probably make a peanut butter and jelly sandwich. Actually,
I think that's because normally this is actually something people love. They do.
Right.
But they've had a lot of it during the pandemic already.
Exactly. I said, if you walk into your kitchen right now, so let me rephrase that, say, after the webinar, if you walk into the kitchen, you could easily make a peanut butter and jelly. We move further up, we see items that fewer people crave, but many more people would prefer to get it outside of the home. We see wontons and chalupas. And finally, if you move to the right, these are items that many people crave and most people want to get from outside the home. So you see a lot of Asian food again. You see the premium steaks like prime rib, filet. You see Asian food, Mexican food, lobster, pizza, and one of my favorites is soft serve ice cream. So again, these are items that are kind of need somewhat of a professional experience to make at home, or need certain equipment like soft serve ice cream.
Yeah, and
So
I think the question is, what sits inside sort of this rough oval over here? I mean, I think that sort of defines where you have pent up demand, right?
right.
Extremely high craving as of today, and if you're going to get it, you don't want to get it from your house. You want to go out and get it somewhere else.
So yeah, these could be like things that people are want to get at restaurants and can't wait to have at restaurants.
Yeah.
So if you look at the next slide, so this shows you the top 30 items that consumers are most excited to have at a restaurant, or like restaurant food they're more excited to have. You see a lot of Asian food, as I mentioned, but you also see some kind of old and new favorites. So if you move down to number 16, you see street taco there. If you go to like number 25 and 22, lattes, which require an espresso machine to make. And at the bottom of the list, you have loaded fries and cheese fries. And those are things are just not as good when you make them at home. They're not as good when you have them from a restaurant.
And we should say we're showing 30 out of several hundred items. So
right.
It's not like loaded fries is actually good. The average item is 100. They're
right.
at a 128. Yep. Let's take a look at the opposite of this. What are the things that people are the restaurant foods people are least excited for? But again, which is a combination of, do you crave it? And then if you do crave it, do you want to get it away from home? So we're looking at the ones that are really high on both those measures. Here's the flip side of that.
So yeah, these are items I think many of us can get at retail and easily make at home, and probably have been doing so more since the pandemic hit. So like oatmeal, baked beans, hot tea. And if you look at the bottom of the list, also we have steamed vegetables, spaghetti, a lot of things that are easy to make at home, and probably a lot of people have been making at home for the past few months.
So are you surprised that spaghetti's on there?
I am, because traditionally I think a lot of people would go to an Italian restaurant to have spaghetti, but I think a lot of people are probably making it at home right now. I myself included. I would much prefer to get it from the outside, but like when the pandemic first hit, I was making it a lot at home.
I wonder what business has been like at those. There's some like those restaurants that are just grilled cheese restaurants. It's like it's all they do. Maybe it's a grilled cheese truck, or it's actually a brick and mortar. I wonder how business is there. Given I've eaten an unbelievable number of grilled cheese sandwiches over the past several months.
Yeah,
I think
that would be interesting to see.
Yeah. So I can touch on this too. So let's look at a couple of the things. Again, we have hundreds of different food items, and the top chart here shows the food items that people say, hey, if I'm going to have this, these are the ones that I most want to have away from home. So if you're going to have that, do you want it away from home or at home? These are the ones that have the highest away from home number. Like we saw some of the ones in that earlier slide with like wontons and chalupas and not. You get to see sort of the full list of the top ones here. And then if you look at the bottom, let's look at the things that people say, yeah, these are the things I most want to get from home if I'm going to have it, right? It's the PB&J, it's sloppy Joe, it's a pork chop, it's turkey overall, it's pancakes and whatnot. And the thing that we want to note here is it is really striking how big the differences are, right? If you're going to have Japanese food, 77% say, yep, I'm getting this away from home. If you want to have oatmeal, a similarly high percentage, 78%, I want to get this thing from at home. These are really big swings. And I want to see if you notice something here. So this is that top chart we just saw on the previous slide. The things that people most say they want to get away from home if they're going to have it. Do you notice anything with these items? Just take a look at them. Use the chat. What do you notice about these items that maybe starts telling you a bit of a story. The things that people most want to say, I'm going to get that away from home if I'm going to have it. Well, I don't know if you're following along chat,
Yeah.
Sean, and we are running a little bit out of time, so I'm going to
Yep.
accelerate a little bit.
A lot of people got it.
Yeah, they tend to be things from like around the world, right? That's what people go to restaurants for. And we could actually break this down a little bit further. So again, this is all coming from that brand new flavor data. Um, Here are the different types of cuisines. And for virtually all of them, a majority of people say, yeah, I'd rather get that away from home. By the time we get to American food, people are like, yeah, I'm good. I can make that at home. Only 24% say I prefer that away from home. And you can argue that Italian and maybe even Mexican food are in that category too, where they're in some way they're almost just been absorbed into American culture and just feel very sort of normal and common to us. But all these other ones, right? These are things that people really say, I want to go to a restaurant for that. These are things that people have not generally been able to have as much lately of because of the pandemic. So we noticed something too, where we took those hundreds of different things that we evaluated and we grouped them into, oh, is this food representative of a specific cuisine? Is this a dessert? Is it a pasta? Is it a pizza? Is it a breakfast or something? And we've rank ordered those groupings based on the ones that people say they most want to get those types of things away from home. So these are category averages, and here are the categories. And the things that people say I most want away from home is all the global stuff, different cuisines, global entrees, global appetizers. This is the appeal of restaurant and away from home food, principally, more so than any other classification that we can find. This is the thing that drives the industry forward. A lot of you may know us for the menued options cycle that we do. Here's a menued options cycle for pastas and noodles, right? So different noodle types. Inception are really early stage trends. Ubiquity, the trend is really common. We're able to look at those hundreds of items and categorize them based on their stage of the menued options cycle. And then based on that stage, derive an average of whether people want those items from home or away from home. And the earlier you are in the trend cycle, the more likely people are to say, I want that away from home. By the time you get to ubiquity, people are like, yeah, I'll have it at home, that's fine. But if you're talking like an inception stage ingredient or food or adoption or proliferation, it's like a factor of like 2 to 1, preferring it for away from home versus from home. Early stage stuff, as well as global influences, that's the real appeal of restaurant food. Just other things, the service, everything else. But regarding the food itself, the real appeal is global and its earlier stage. And we actually have a term that we've been using for a while now, going back a couple of years, as to what the best approach to innovation is if you're in away from home, if you're in the away from home business. And it's fusibiquity, which is to take something that's ubiquitous, like a sandwich or a pizza or some platform that everyone knows, and combine it with new flavors and influences from around the world. That way it's still pretty safe to consumers because, hey, I love pizza, how bad could it be? But it's got some new take to it, which keeps it interesting. It's also what makes it something they just can't pick up from the store or make from home themselves. It's what gives restaurants an advantage. It's why we've seen surges in things like, Korean fried chicken sandwiches or Asian chicken wings or Middle Eastern flavors and ingredients that most people couldn't pronounce, put in the context of a bowl that everyone all of a sudden loves. And I think the story for us is pretty clear that it's really innovation that determines and drives how food service wins. And we just wanted to, serve that up as a reminder that if you're working for a company that's thinking, yeah, maybe we'll pump the brakes on innovation a little bit, we would really encourage you to rethink that. Most of the companies that we've worked with, and we work with a pretty big spectrum of manufacturers and restaurants and other people in the food system, they're continuing to move forward with innovation in a big way. I think the message has landed clearly, and I think they're going about things well, and they're going to have a nice, robust pipeline going forward. If you're with a company that maybe has not made that strategic decision, you may just want to think about that a little bit more, because this is what's going to get people out of their homes and consider getting food from a restaurant versus, just whatever's in their cupboard. The game right now is not, how do you compete with other operators? It's how do you compete with just picking something out of the cupboard? And innovation is the way to do that. We're going to go a little bit over on time, so let's consider this bonus content for anyone that wants to stick around for an additional 5 minutes. We'll share some information on brands that we've discovered, or you know what? Yeah, let's go ahead and do it now. So if you can stick around for 5 more minutes, great. We're going to feature that. If not, I'll remind you that we have another webinar in 2 weeks. We're featuring Dr. Paul Rosen, who is, to me, perhaps the most enlightening person in the entire world of food. And he's going to share a lot around the psychology of food, the psychology of a pandemic, and what it all means for us and our human natures. And it's going to be utterly fascinating. If you can't stick around, Sean's going to share a little bit of information from our Brand Fingerprints platform. So, Sean, we took the information of Brand Fingerprints and we added a number of new pandemic recovery metrics. Brand Fingerprints covers the top 200 restaurant chains, and in addition to that, many of the top C-store and grocery chains. Today, we're going to look at restaurants as it relates to some of these metrics. So, you want to take us through some of the things we learned?
Sure. Yeah. So what we did was we looked at restaurant chains, and we looked at several different metrics. Some for the menu items, how they want to look at menu items. We have questions on safety, and here we're going to look at some menu item questions. So for this first one, we looked at restaurant chains that have items that consumers have been craving. And we divide up by the four restaurant segments: QSR, fast casual, all the casual dine. And if we look at the brands at the top of each segment are the leaders of that segment for this question. So if we look at Chick-fil-A, for example, Chick-fil-A, 65% of consumers said they are craving food from Chick-fil-A. It's 13 points higher than the average for QSRs, which is the 52%. Now let's kind of look at that bar. What does that bar mean? That bar basically means the gap between the lowest ranking QSR chain and the highest, which is Chick-fil-A. So kind of for a reference, the one in fast casual, that gap is much narrower. Next slide. Here we looked at restaurant chains that have meal bundles that consumers want to see in a family meal. We see Polo or Pollo Tropical, mostly in Florida chain, that's topping the QSR list as well. And so let me, like 79% of consumers said they have food that they would like to see in a meal bundle, family meal bundle. Not surprising, when I actually looked at their website, they have a family meal bundle menu. They offer like a whole chicken. You can have 3 sides from a lot of sides, and several different sauces that they offer. On the next slide, how about food fit for delivery and takeout? So we asked consumers about both. Since pizza delivery is the largest meal delivery industry, it's not surprising to see 2 pizza chains at the top of the list. We see Domino's Pizza tops the QSR list, and we also see Mellow Mushroom, which is a smaller pizza chain that's located mostly across the South and mostly around Atlanta. And I've actually been there. It's a really good place. So they top the casual dine. But we also see other kind of restaurants. So we see Jimmy John's, like a sandwich restaurant, with their freaky fast delivery tagline. They top the fast casual segment. And so we also see some regionals like Zaxby's in fast casual for takeout.
Yeah, and I could maybe just jump in real quick. So one thing that we're providing alongside with companies that subscribe to Brand Fingerprints is a tool for these new pandemic recovery metrics. And some of the metrics are around the notion of safety. And it's really quite interesting. There's a lot of nuance in this. So if you look at a chain like Chick-fil-A, it ranks #1 in overall trust. I trust this restaurant chain to keep me safe. It ranks #1 in sanitization. I trust that this chain is sanitizing frequently into the highest standards. But it's only about middle of the pack for this notion of there being zero risk, if I were to enter the restaurant. I think it's because Chick-fil-A has done such an incredibly amazing job with its drive-through, for one, that people aren't even thinking of the need to go in. And also that if you think about, something like a place like Chick-fil-A, maybe there's a kid's playground, or there's a lot of, normally in normal times there'd be a lot of families in there and a lot of people, in that space. That could be weighing on consumers' minds. So understanding those nuances, I think, are really great for knowing, where you should sort of accentuate what's really strong about the brand, and also where there may be things where you need to take some corrective action, specifically coming out of COVID. There's also some measures around loyalty, right? Are you willing to go out of your way to get some food from this place in the midst of a pandemic? Or do you find that the brand is doing enough to support the community, or that it's part of the community, that it's showing its humanity in a positive way, and that it values its staff and employees, all things that have become more important during COVID. With that, I know we've gone way over on time. I apologize. If you'd like more information about flavor or brand fingerprints or anything else, just let us know. We're going to have another great session on August 6th. That's 2 Thursdays from now. Again, that's with Dr. Paul Rosen. I consider him the most interesting and enlightening person in food, so please do not miss that. It should be awesome. And if you aren't in contact with us already and want to learn more, or just have a conversation, you can reach us at hello@Datassential.com. Thank you again, everyone, especially for all of you that stayed a little bit later. Stay safe out there, and we'll see you in a couple weeks. Bye, everybody. Sean, thanks so much for that. I'm going to go ahead and stop sharing out the screen, and we'll give everyone a couple of seconds to jump off. I apologize, we had to cut ourselves short.
That's right.
A little bit, but there's still so much great information coming out of these new pandemic recovery metrics that I'm sure we'll be able to share some more in the future as well. Thanks again for jumping on such short notice.
Oh, my pleasure. My pleasure. Thank you.
Yeah. And thanks again, everybody. We'll see you soon.
Bye. Jack, do you need to stick around, or are we good?
No, I'm going to hang up on you and everybody else right now.
Okay. Thanks, Jack.
Bye.